The university has an infectious disease response plan that we have had for several years, and we've revised it for this specific outbreak. This plan will allow us to gauge our response on how serious the disease is, how close it is, are there treatments available, et cetera. So we have our plan in place. It's had input from a wide variety of people, including Boulder County Public Health. We are following that plan. And for example, we are providing personal protective equipment to people who want that. We have training slides posted on the web for staff, faculty, and students who want to learn more about how to protect themselves. We're getting a message out that if people are sick, they really need to stay home or in their dorm room, cover their coughs and sneezes. We're communicating with faculty with the message that we really need to be lenient with our absence policy to discourage people who are ill from coming to class. That's the best way we have of slowing down this particular flu. We're also working on a media campaign to get those messages out to our public.
Some of these students appear quite ill. If you've ever had a fever of 103, it's pretty miserable. There are other students who've tested positive, however, who don't appear to have more than what looks like a common cold. So there's a variation of symptoms and severity.
Who should be going in to get
The
tested?
information that we want to get out is that not everyone does need to be seen for this illness. Just like many of you wouldn't go to the doctor for a common cold, it's not necessary for the average person to be seen. We do, however, want people who are at risk of complication of influenza to be seen and seen early, within 48 hours of illness onset. Those people would include pregnant women, individuals with any chronic illnesses like diabetes or asthma, and any individual who might be immunosuppressed. They need to be seen early.
But the other students who are running high fever should probably be seen too, or no?
No, we're offering, they can be seen. We're obviously available to see the students, but we don't want the message that this is any unusually severe disease that everyone has to be seen. We are staffing nurse phone lines to be able to talk to students who have questions about, do I need to be seen or not? And that's available on an ongoing basis, and we're taking a number of phone calls every day.
Symptoms just like the seasonal flu?
Yes, so ordinarily it's fairly sudden onset of fever, sore throat, cough, and in about 10% of individuals we are seeing some gastrointestinal symptoms like nausea, vomiting, and diarrhea.
If it came to that point where we really felt that quarantining of well people away from sick people were necessary, we would recommend it, and we're not at that point. We recommend that individuals who are sick stay home, and in this case, the home is the dorm residence for some of these students, and just follow those, again, those precautions, whether you're ill or well, of covering your cough and sneeze, washing your hands with soap and water frequently, and really just staying away from other people while you're sick.
I believe that there are some extra cleanings that are being done in the housing and dining areas. But in general, the spread of disease that we're most concerned about is this respiratory spread, the coughs and sneezes. So that's why it's so important for people to cough into their sleeve, cough into a tissue that they then discard, stay in the room if they are ill, avoid close face-to-face contact with people who are ill.
It is unusual. So we normally do see kind of a lull during the summer season, and we did have outbreaks, especially at camps where children are residing together, similar to a dorm setting at a college. We were seeing outbreaks of disease, and so we do expect in a normal flu season for that to go away. So it's definitely behaving differently. And again, like I said, it's affecting a different population. We're seeing more severe disease in younger people, and we're not seeing disease in people over 65, which is generally who we see the most severe disease in seasonal flu or regular seasonal flu that we've had.
We're following the Centers for Disease Control and the Colorado state guidelines that are recommending only using the Tamiflu antiviral type medications for people who are at risk for complications. So again, that comes back to those individuals with asthma, diabetes, pregnant women, and other immune compromised states. And we're having some parents who express concern and wanting their children or their sons and daughters to be treated, and we're really holding the line and being quite cautious about this. Our big concern that if those medications are overused, that resistance will quickly develop. So that's an important issue. Under normal circumstances, professors do have their own policies about how many classes can be missed, and will request notes from our facility and from other private doctors' offices to account for those absences. This year, the communication has been direct and clear to professors that they should be lenient about that. And we're advising students who are hearing otherwise from their professors, perhaps the message hasn't gotten through to them, that they should speak with the department chair if they are getting that kind of pressure. Well, treatment is being limited to people who are at high risk for complications, number one. Number two, we feel that many of these people can get the advice that they need over the telephone to adequately treat their symptoms and get information about indications that would make them seek medical care. And we're also being cautious about the fact that we don't want to overwhelm either our system or local emergency rooms and urgent care centers, so that if this continues to rise in terms of number, that we have the ability to see the people that actually need to be seen.